Good afternoon, everybody, and welcome to our regular media availability. As is usual, I will turn it over to Dr. Fitzgerald to provide her daily update. Janice?
Thank you, Minister. Good afternoon, everyone, and thanks for joining us today. Since the media advisory yesterday, we have one new case in the province. This individual is a female between 20 and 39 years of age, and it is related to international travel. There's one person in hospital, and the total number of cases in our province is 395. 383 people have now recovered with 5 active cases, and in total, we have tested 75,973 people. I'd like to address expectations around timelines for vaccine administration. We receive regular shipments of vaccines, and the regional health authorities work diligently to ensure that their allotment is administered as expediently and efficiently as possible while ensuring a quality vaccination program. It is unrealistic to expect that a shipment of vaccines is to be administered within a day or two of its arrival. It is important to recognize that there are significant logistical requirements that need to be arranged, and once the shipment arrives in the province, it is transferred to the regional health authority depot, where it is then distributed to the communities that will be receiving it this week, or that week. The administration process requires protocols such as consent and education. Delivery to rural and remote communities, such as along the coast of Labrador, will take time. Administration in long-term care homes takes time. To date, regional health authorities have completely administered their allotments of vaccines within approximately 1 week of its arrival in the province, which is phenomenal, considering the planning and coordination required. As Mr. Haggie mentioned earlier this week, some regional health authorities are getting more doses per vial than anticipated, which means more individuals can receive their first dose. I know that everyone is anxious for vaccination to happen as fast as possible, and I assure you that is the case. We need everyone to be patient and wait for their turn, based on where they fall in our priority groups. The vaccine will come, but for now, continue to do your part in keeping COVID at bay as we do our part to vaccinate our population. We hear of the tremendous difficulties with COVID-19 the people in other provinces are dealing with right now. Because of our success, we can feel removed from these realities, but nevertheless, they are still there. There are people here at home that are feeling those worries and sadness, and we need to keep this in mind. We do not know what others may be going through, and some days are tougher than others. What we can always do is to be kind, whether that is by offering support or simply choosing not to be unkind to others through social media. We are fortunate with our low case counts, but we all know people who live in other provinces or countries where the situation is very different. We see the social media posts, we hear the news coverage, we talk to others about their stories. It can be a lot to digest. We must be mindful of our mental health and the impact the pandemic can have on ourselves and on our families. So I want to remind everyone who needs this, including our rotational workers and their families, to reach out if you are feeling anxious, sad, or lonely. Help is available. You can call the Provincial Warm Line at 1-855-753-2650. 7 days a week from 9 a.m. to midnight to speak with a trained peer support worker who is there and ready to listen. Mental health and wellness services are also available to you and your family through Bridge the Gap with 2ps.ca, and these age-appropriate programs and services are available locally, confidentially, and free. If you or someone you know are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line at 1-888-737-4668 to speak with a mental health clinician any time of the day or night. As a recap for those who may have just joined us, we have one new case since yesterday's media advisory, and the total number of cases in the province is 395. We are so fortunate to have continued low case counts. Thank you all for your efforts this far. We will get there, and we will get there together. So hold fast, Newfoundland and Labrador. Thank you.
Thank you very much, Dr. Fitzgerald, and we're now on to vaccine delivery day 31. We have 5 active cases, and our case count per 100,000 is the lowest in Canada. We have done very well, and as Dr. Fitzgerald says, we need to hold the line and continue with the measures that she has provided us with to help us keep things under control. Certainly, vaccine delivery is a hot topic, and really because of the things that Dr. Fitzgerald mentioned, figures that we provide even on the website are simply a snapshot at a moment in time. For example, last night, within the space of an hour or two, we went from having delivered 91% of our Pfizer vaccine to having only delivered 51%, simply because we got a delivery that arrived within the province. And so our aim is to try and reduce the amount of time vaccine spends in the supply chain between arrival in the province and getting into someone's arms. We have made a conscious effort now to administer the vaccine as it goes for people who have not been vaccinated, bearing in mind we're starting still yet with the high-risk groups such as essential healthcare workers, people in long-term care facilities, and isolated fly-in Indigenous communities particularly. As the supply chain continues, we will then have to divide our vaccine doses if our numbers allow and our epidemiology allows for us to administer second doses, because NACI still are recommending the 2-dose regime following the manufacturer's guidelines of 21 days for Pfizer and 28 for Moderna. That was confirmed again less than 2 hours ago to me on a health minister's call. One of the things that is potentially going to impact our delivery is news from Pfizer today that because they want to improve their output at the plant in Belgium, which is where Canada gets its supply from, there will be a temporary reduction in the expected dose deliveries over the next 3 to 4 weeks. What that means for Canada next week is that it will receive 195 trays instead of the 214 that were scheduled. The last week in January will be the worst, with only 25% of expected trays being delivered. That's 41 for the entire country. Then on February the 1st, they'll go back up to 175 trays, and on the 8th, 200. And by March, they will compensate by delivering more, so that at the end of Q1, we will still get, as a country, the allocation that we were promised and believed we would get. Q2 of the vaccine schedule would see Canada getting 8 million Pfizer doses and 12 million Moderna doses. The details of how those would be apportioned will be provided to us from the federal government. In terms of numbers, we get 1.4%. Those numbers will be provided to us over the course of next week. We're also expecting the federal government to give us precise numbers within the next 48 hours of our 1.4% of the reduced numbers that will come between the end of January and the middle of February. That will slow delivery and is obviously a source of some concern, but really it's a factor that is outside our control. And Major General Fortin is actually speaking with Pfizer on a regular basis to try and see if there can be further mitigation of that dip in vaccine supply. The other discussion from the health ministers meeting today was around the testing panel. This has submitted its initial report, and my understanding is that will be made public within the next 24 hours or so. But essentially, the news for Newfoundland and Labrador is that our Director of Provincial Laboratory Services feels that this validates the approach that Dr. Fitzgerald and her team have recommended and that we have taken. And it highlights 3 further areas that they would wish to provide more detailed focus reports. From the point of view of us as a province, they are going to concentrate on travel and how testing and what testing modalities are available can be used to try and improve travel I note yesterday that the Premier of BC is looking at a restriction on inter-provincial travel within Canada for residents of British Columbia. The second area they want to look at and provide a report will be about surveillance of population and sentinel surveillance. And finally, the third area is around communicating with high-risk populations who, certainly in other jurisdictions in Canada, have been difficult to get to test. So those are areas at the national level which we were briefed on within the last couple of hours, and I think may be of relevance and interest to us. For the moment, however, we have a clear path ahead to administer vaccines. The communities of Sheshatshiu, of Con River, and the long-term care facility in Harbour Breton will receive their vaccine starting on Monday, and the rollout through Nunatsiavut should be completed by this weekend, finishing up in the community of Nain, having done all the fly-in communities on that coast, with the exception of Natwashish, which will also start on the 18th. So with that, again, I reiterate Dr. Fitzgerald's mantra of hold the line. We have done very well, and we are the envy of Canada, and indeed, I would argue, a lot of the world. And so with that, Leslie, I'll draw my remarks to a conclusion and open it up to the media.
Thank you, Minister. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are for Peter Cowan with CBC. Please go ahead.
We're expecting an election campaign any day now. How will this province manage its response to COVID-19 during the election? Normally, there's sort of a caretaker government and no big decisions are being made. Dr. Fitzgerald, I'm wondering if you'd be able to answer, as things come up and things need to happen over the 28 days of campaign, how are you going to handle it?
So, clinical decisions that have to be made based on public health evidence will still be made. And we certainly will be continuing to do what we've been doing in the rolling out the vaccine and responding to any COVID cases as need be. And, our policies are in place. We feel comfortable with them. So I think at this point, we'll be carrying on with the status quo. And I can put that over to the Minister if he has anything to add there.
Yeah, I think it's worth pointing out a couple of things in response to that question, Peter. Firstly, the Public Health and Health Promotion Act that we read into law in 2018 vests the authority for public health decisions during a public health state of emergency solely in the hands of the Chief Medical Officer of Health, Dr. Fitzgerald. That does not change simply because of a writ period. The caretaker convention says that civil service carries on with routine business, and that in the event of urgency or emergency, the minister is still the minister, and the premier is still the premier, and cabinet is still cabinet until they are sworn in by their replacement. And I think that framework provides some comfort in terms of the mechanics of an election. The chief electoral officer last fall, I think, issued some fairly comprehensive guidance on the conduct of an election during a pandemic, and indeed there has already been a successfully held by-election with no untoward public health effects.
I want to get a sense of what the briefings are going to look like over the next month. We saw in New Brunswick, for example, the Premier and Health Minister didn't attend those briefings during the writ period. How will things be managed here?
It's my understanding, Peter, that the daily news releases will continue, and that Dr. Fitzgerald will make herself available in a similar format to this on a weekly basis. And again, if there is any need to change that, or there are any concerns, particularly through the media, these can always be directed to the communication staff. But obviously, if there is a sudden change in our public health status, then those arrangements would be revisited.
Thank you.
Our next questions are for Kellyanne Roberts with NTV. Please go ahead.
Thank you. Minister, you noted that in the health ministers meeting, the change for the vaccine doses earlier in the week, it had sounded like we would be getting more. Can you just go through that again, sorry, what our delivery will look like and what that means for the rollout here?
The exact delivery numbers will not be provided to us by the vaccine team in Ottawa, Major General Fortin and his staff, for probably 48 hours. But in broad brush principles, the next week's supply for Canada will be 195 out of 214 trays, so our amounts will be reduced pro rata. And for the last week in January, the country's only going to get 41 trays. So the exact detail of how many doses that will translate into, we should have available early next week for you, and we can share them when we have them.
Thank you. And Dr. Fitzgerald, many elders have been reaching out, noting that age obviously is a factor when it comes to vaccinating, and they will likely be either at the end of priority 1 or near the top of priority 2. Many of them wondering how they'll be notified to know that they should be vaccinated and when.
Yeah, so as as our plan rolls out, we'll certainly have communications about that and how people will be notified. It'll certainly be through briefings, it'll be through advisories and other means of notifying that. But the exact details are being worked out as we speak. So we'll when we have that information, we'll be passing it along. But it will be a transparent process. And that information will be going out through healthcare providers as well. So,
thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Across the country, a lot of people have now received their double dose of the COVID vaccine. I'm curious, have protocols been put in place for people who have received both vaccinations and want to travel to Newfoundland and Labrador?
So right now, anybody who has received both doses of the vaccine, because the evidence is still evolving and we don't know really what the effect on disease transmission will be, we will only be able to find that out as we have more experience with the vaccine. The public health measures that we have in place will remain in place until we have more information and we have evidence to support being able to lift those measures. So right now, all of our guidance that we have given up to this point about, making sure you maintain physical distancing, wearing masks, washing your hands, isolation, all of that will remain in place.
And to that point, once again, before on these briefings, we've discussed the possibility of potentially giving out those proof of vaccination cards to those that have received their shots so they can more easily travel, et cetera. I'm wondering if we can get an update on that. Is that still something that we're considering, and what's the update on that?
So a proof of vaccination card, for the reasons I just talked about, would not really be something that would help people travel more easily at this point, because those public health measures would still have to be in place. And again, we don't know what the effect on disease transmission will be. So if people want evidence to say that they've had the vaccine, that's one thing, but how at this point how it will make it easier to travel, and that is not, it's not really clear that that will be of benefit.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. Dr. Fitzgerald, at this point, do you think the use of campaign buses and live campaign events would be wise in an election, given the potential to spread the COVID-19 virus?
So certainly, I think all of the parties are quite well versed and are well aware of what the COVID-19 guidance is and how they best implement that with regard to their own the safety of the people on their staff and the safety of people in communities. So I'm sure that they will have. I have every confidence that they will abide by those guidelines and reduce their risk and risk to the communities as much as possible.
Okay, thank you. And Just another quick question for you. Ottawa has now given its blessing on waiting up to 6 weeks between vaccine shots. I know you said that that's not something you consider, but has that you changed your mind in any way about holding on to those shots?
No, so the statement that the National Advisory Committee on Immunizations brought forward was that they still recommend that that the manufacturer's recommendation for dose interval be maintained as much as possible. That if for logistical considerations, epidemiological considerations, or other reasons that dose had to be delayed, that it could be preferably no longer than 42 days. So that's, so we have a bit of a cushion if something happens that a second dose has to be delayed because of weather or whatever the case may be. But what the recommendation is that we're going to follow, which is to stick as close to the schedule as we can. So what we'll see is us using the doses that come in general, using the doses that come in, and then for the first dose, and then as subsequent shipments come in, we use them for second doses, as opposed to just giving all first doses throughout this first quarter. Of course, with this news from Pfizer right now, we'll certainly have to sit down and regroup and figure out how that's going to impact our delivery program for the next month anyway.
Thank you.
Our next questions are from Josie Bass with Radio Canada. Please go ahead.
Yes, thank you. Actually, my question is related to the last one about vaccines. So is it part of the discussion? Are you thinking about maybe giving the doses with a bit of a delay, like more days than it's recommended by Ottawa?
No, that's not our plan at the moment. Our plan is to follow the manufacturer's guidelines, which is 21 days between Pfizer doses, 28 days between Moderna doses. However, we do have a little bit of a window there, a bit of a cushion, should we run into weather, for example, and doses can't be delivered, they can't fly into a site or something like that. If it's delayed by a few days, we know we have that little bit of a cushion there, but our goal is to give the doses as per the manufacturer's recommendations.
So the 90 days recommendation, like Quebec, is not a possibility for Newfoundland?
We are in a very different situation than Quebec, and certainly, at this point, our epidemiology allows us to do this, and so we think it's important to stay as close to the manufacturer's recommendations as possible.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Minister, I'm wondering if you could elaborate a bit on something from your remarks there. You're talking about how this sort of national strategy when it comes for testing and travel is one of the priorities. So what are some of the options that are under consideration here for how we might use testing in order to be able to open up travel?
I think that's the question we hope that the research will answer. We don't have the volume of travelers, even under kind of older school circumstances, that would enable a powerful enough, statistically powerful, that is, study to be done. So, for example, there was a federal provincial partnership in Alberta around testing upon entry. Those kind of things will help inform whether or not that would allow us to reconsider some of our travel restrictions. But we need solid data before we can do that. The upside of our travel restrictions is they have been an integral, successful part of keeping Newfoundlanders and Labradorians safe and giving you the freedom to go shopping and to enjoy small gatherings with your regular bubble in a way that other jurisdictions now cannot. The downside is that it has not helped our economy at a time when the world's economy, because of COVID in general, has become very depressed. The world economy is suffered because of COVID, but more so than the measures. But the measures I'm hearing, particularly lobbying from the aviation industry and the hospitality industry, that this has made their life even more difficult. So obviously we'd like to try and deal with that, but we can only do that if we have evidence that shows it's safe to change.
And Dr. Fitzgerald, you mentioned a minute ago that the parties are well aware of the guidelines when it comes to campaigning. Can you give us a sense, what are some of the ways and that guidance that you've given about what needs to be done differently when you campaign in a pandemic?
Well, so when we're talking about the guidelines, we're talking about guidelines for gatherings, which we have, those have been on our website for quite some time. So just making sure that gatherings are safe, that they're within the recommended numbers, even if they're outdoors. If they're indoors, that there are masks worn, that there's physical distancing, people are seated as opposed to up and moving around, all of those sorts of things to reduce risks as much as possible. But in addition, we just want to make sure that people are observing those, not shaking hands, those physical distancing, things that we've talked about, hand hygiene, all of that. So, it's an amalgamation, really, I guess, of all of, there's no guidelines for elections per se, as much as they're taking the guidelines that are already there that apply to the different parts and the different aspects of election campaigns and applying that appropriately.
Okay, thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. As of January 7th, there had to be proof of a negative test before boarding a flight to enter Canada. The last 2 days, we've had international travel-related cases. Had they returned before that date, or were we aware of their positive test before arrival?
So I can't speak to individual cases specifically, but what I will say is that people, they need to have a negative test right now to get on a plane and come here, but they can turn positive after they get here. So, that's not unexpected at all, that someone could be negative when they get on the plane and positive a week later or even 3 days later for that matter.
Thank you. And I've had a few people ask now, when it comes to being vaccinated, people who have had COVID at this point, should they be getting the vaccine immediately, or allowing those who haven't, I guess, been exposed or had COVID at this point to be getting it ahead of them?
So I guess that's really something that is really still under discussion, and I think it's so few people here in this province, thankfully, that we take that on a case-by-case basis. But again, we don't know what the long-term effects are of having the disease, if that confers long-term immunity. So, certainly we would recommend that, we wouldn't recommend against, let's put it that way, somebody who's had COVID to not get the vaccine. But that would have to, it's an individual case, and everybody would have to sort of evaluate that on an individual basis.
Oh, thank you.
No, thanks. Sorry, Kelly.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. So we continue to hear from rotational workers and some of their concerns regarding self-isolation and whatnot. We recently heard from one worker who's wondering why rotational workers from outbreak sites who have received a negative test result and are asymptomatic are required to isolate away from their families for the full 14 days still, rather than begin a modified isolation. So I guess, Dr. Fitzgerald, can you clarify the rationale behind that?
So our incubation period is 14 days, and that means that someone can turn positive anywhere inside of that 14 days. We know that people who are coming from an outbreak site are at a higher risk of being exposed to the virus and potentially contracting the virus than those who are not coming from an outbreak site. And certainly we have seen that the majority of our rotational worker cases have been related to outbreak sites. That is the rationale. We've tried to reduce the impact of isolation on rotational workers as much as we can, but we do have to balance, the health and safety of the population with the well-being of those rotational workers.
And we've seen numerous other vaccines, or heard of other vaccines now, other than the Pfizer and Moderna, with varying degrees of effectiveness that are trying to get approved for use. How confident would you be in putting a vaccine into circulation that has one of those lower effectiveness rates, say 60%? How confident would you be in putting that into circulation here?
So I think a 60% effectiveness rate is better than no vaccine at all. With that would be no effectiveness. So, it's our flu vaccine. We see this with our flu vaccines, various years that effectiveness can be lower than others. It's still we do still know in the example of influenza that it still reduces spread and it can be protective. So. I think those are considerations that will have to be made as each vaccine becomes available and we have more information about the effectiveness of those vaccines. But it'll be a weighing of risks and benefits. And if Health Canada deems that the efficacy of a vaccine is appropriate, then we will be using it.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I think this has been answered in previous briefings, but we've had 3 or 4 cases now of international travel, and can we take from the lack of detail that these cases are not related to each other?
I can't go back through all of them now in my mind, but certainly most of the international travel cases that we've had have been, distinct cases. There's, but I wouldn't be speaking from fact at this point, Peter, so I don't think it would be fair for me to say it at the moment.
I was just going to say there is one today. So.
Yeah.
Okay, and the other question was we are getting less Pfizer vaccine in the short term, but between April and June, we could be getting, by my calculations, I think 280,000 doses over that span of time. Is the province ready to ramp up vaccination?
Absolutely. We've given 230 plus thousand doses of flu already. And that was in the middle of a pandemic while we were dealing with outbreaks and everything else. So yes, absolutely the province is ready to deliver the COVID vaccine. We have a fantastic team of public health professionals in each of the regions. We have a fantastic team at the province. We know that we have community partners in our family physicians and our pharmacists. If the need be, that we can call on to help us with that, as well as many other vaccinators out there. So we've no worry and complete confidence in our ability to be able to deliver the vaccine.
Just as a reference point there, Peter, last year consistently the Eastern Health Centres, public health centres, delivered over 5,000 vaccines a day, and I don't think the system was particularly stressed. I think the peak we've had in Metro with flu this year because of the appointment system on a day may have been around 2,000, but there is scope there to increase that should we have the vaccine supply to do so. That 280,000 increment, we're hoping that we should have some more information over the course of next week as to when that might arrive and what kind of time scale and delivery dates we could expect. But at this stage, I suspect even those numbers would be what the federal individuals would regard as for planning purposes.
Okay, thank you.
Our next questions are from Josie Basque with Radio Canada. Please go ahead.
Thank you. My question is about, if we, in the future, we're having elections, what would be the recommendation? I don't know if someone asked the question before, but what would be the recommendation of the public health about votes? Is it more, what's the advice, like, are people supposed to vote by mail or by special ballots or anything?
So certainly, if the voting process itself, obviously, if you can vote by mail, then that will be great to be able to do that. It'll take away the need of having to attend a polling station. But the elections, Newfoundland and Labrador, have been in discussions and know what they need to do to be able to reduce that risk at polling stations.
So there's no specific recommendation by public health about that?
The people who are in charge of running the elections have developed plans. We've certainly had input. We've had discussions with them about that, but we didn't develop the plans for the election, no.
Okay, thank you.
I will now go back to each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I'm good, thanks.
Thanks, Peter. Kellyanne Roberts with NTV, do you have a final question?
I do. On Wednesday, I had asked if all three of you would be in attendance for today's briefing. Obviously, there is a face missing today. Minister, I'm wondering if you can discuss why the Premier is not in attendance for today's briefing.
Honestly, I can't. I only found out kind of by accident shortly before this started. I checked back through Twitter and noticed that it was just myself and Dr. Fitzgerald. So I know as much as you do.
Thank you.
Richard Duggan with VOCM, do you have a final question?
No, that's it for me. Thank you.
Thanks, Richard. Peter Jackson with The Telegram, do you have a final question?
Yes, just one quick question about housekeeping. The vaccine data on the hub does not include regional breakdown, which I think we were originally promised. Is that going to come, or is that being abandoned?
My understanding is that was going to come, Peter. I wasn't aware of that. It may be a glitch, and as I said, we probably would have to tweak it over the course of the first iteration or two. I will go back and investigate.
Thank you.
Thanks, Peter. Josie Basque with Radio Canada, do you have a final question?
No, that's it for me. Thanks.
Thanks, Josie. All right, thank you, everyone. Minister, do you have any final comments today?
Yes, thanks very much, Leslie. Just to thank everyone for their interest, and we will keep people informed, and we will plan to see you next week, and who knows what the future holds.
Thank you, Minister. Take care, everyone.